Hi, I'm Dr. Isaac Kuyunov here at Dental Prosthodontics of Rochester. We get a lot of questions about dental implants, so today I'm going to discuss about them and answer some of the most common questions about dental implants so you guys better understand what dental implants are. So what are dental implants and when are they recommended? Dental implants are replacement for teeth, and they are shaped as a root of a tooth. So imagine yourself, if a tooth is missing, the dental implant will replace the root of the tooth. This is dental implant, and on top of the dental implant, we can place a full tooth so that when you have a dental implant, you can place a tooth that looks like a tooth. But a dental implant is only this part. It's a root form of a missing tooth. Dental implants are recommended when a person is missing a tooth and a person wants to have a tooth replacement, or when multiple teeth are missing, or when all the teeth are missing in one arch or both arches, one jaw or both jaws. And dental implants can replace from one tooth to multiple teeth to all the teeth in the mouth. What conditions may disqualify a person from getting dental implants? Different conditions can disqualify a person from getting dental implants. One of them is not being medically fit for dental implant surgeries. These may include different diseases, medical conditions, for example, diabetes mellitus type 2, if the blood sugars are uncontrolled, hemoglobin A1C is very high, that will preclude or will decrease the chances of dental implant survival and success for these patients. Different medications will also will indicate that a patient is not a good candidate for dental implants. These medications can include any type of bone density medications such as Prolia and Zometa. Within this category, different medications that affect the bone quality. Um, there is really a whole line of dental conditions, medical conditions that will disqualify a person from getting dental implants. So that's why you really have to check with the dental provider if you are the right candidate, if your medical condition is good. In addition, if a person does not have good oral hygiene, this also is going to decrease the chances of dental implant success, because dental implants need the same oral hygiene and care as natural teeth, if not even more so. But it does have to be taken care of, just like for natural teeth, if you want them to survive. Um, Other things that can disqualify or at least decrease the chances of implant success are smoking and people who do smoke. For them, the success of implants is less good than for people who are not smoking. What are the benefits and risks of dental implants? The benefits of dental implants are that a person who's missing a tooth will get a replacement for the missing tooth or for the missing teeth, and the teeth that are going on implants are usually fixed, of a fixed type, which means that they're not removable, they're staying in place. And if it's a fixed bridge or a fixed crown on implant, it will resemble as close as possible to what you had before in a natural condition, natural teeth. Implants can also have, when a person missing all of the teeth in the mouth, or some of them, implants can assist with a removable appliance in a snap in, snap out type of situation, where a regular partial denture or a regular denture will be not as retentive. With dental implants, this retention is going to be increased dramatically and can really improve the quality of life of a person who is having dental implants. What are the risks of dental implants? The risks are the same as for any other surgery a patient may undergo, whether it's in the body or in the mouth. Dental implants, it's a involved surgical procedure to place them in. And if a person is well and is healthy, the chances of not doing well are decreasing dramatically. The chances of doing well are very good. If the person is not really healthy, it has to be really considered by a dental provider whether you are a good candidate and whether you can undergo the risk of dental implant. What are the different types of dental implants and dental implant procedures? There are different types of dental implants, and I can go through them one by one. The first type of dental implants is when a person is missing one tooth one tooth. So a dental implant is coming, replacing a single tooth. All right, single tooth replacement implant. Now, let's say single tooth replacement implant. Let's say a person is missing three teeth. Then you can have two implants holding three teeth in place. So this will be a dental implant bridge. It's for three teeth, four teeth, five teeth, or even all the teeth. It can be a dental implant bridge. Another type of implant restorations are what we call all-on-X type of restorations. These are full arch dental implant fixed prosthesis. It's a bridge that is being held by multiple implants. It's a one solid bridge held by multiple implants, and it can be four implants, six implants, or different numbers, but usually not less than four. And I discussed about it before in previous videos. But for example, this patient has no teeth at all, and it will have a one type of a bridge over all the implants, and that's why it is called all-on-X. It has different names in the market, all-on-4, all-on-6, but what it really means is that all of the teeth are being replaced by a few implants in the jaw, and it's a fixed prosthesis. It's not being removed, it stays there. People really like fixed type of prosthesis because they don't have to remove it, and it stays there, and it makes them feel like it's a more natural type of replacement of the missing teeth. The other type of dental implant restorations is when it's removable denture, for example, but it's being assisted by the implants in a snap-in type of situation, and the denture is being snapped in over the implants, and it's more secure. There is more retention, and it really helps with the removable denture. So a removable denture can become removable denture assisted by the implants, and really increase the quality of life of a person who has dental implants. The different dental implant procedures include dental implant placements. They include bone grafts and site development and augmentation, meaning if the person does not have enough bone volume because the implant has to be rested within the bone. If there is not enough bone volume, then your dentist may opt to increase this bone volume by a procedure that is called bone graft or bone augmentation, and this another procedure that is added on before implant placement. How will a dentist decide if dental implants are right for you? This is have to be discussed with your dentist to see if dental implants are really a good solution for you, because there are a lot of considerations going into place to decide whether dental implants are right for you. If you're missing a tooth or multiple teeth, and if you're healthy and you have a good oral hygiene and you have a good volume of bone in your jaws, and implants can be lodged there with high success rate, then you are probably a good candidate for dental implants. And if this is the right procedure for you and you opt to go with this, then it's great. If some of these things are not in place, you're not healthy, or there is not enough bone volume, or you do not want to go through surgical procedures, then maybe dental implants are not the right option for you. Then we have to look into other options to replace your teeth, and there are other good options to replace your teeth. Dental implants are only one option, a good option, but it's only one option of tooth replacement. What are the steps of getting dental implants? Well, the steps are, first of all, you have to come for a exam, which includes the dental thorough exam. The dental exam includes not only clinical exam, but also a CBCT, which is an image that gives a three-dimensional volume of three-dimensional X-ray of your teeth and your bones, that where the teeth are lodged or where the implant is going to be. This will show how much volume you have, and if dental implants are a good fit for you. In addition, during the first appointment, medical history will be reviewed, and the doctor will go over with you over all the medical conditions and medications, and how healthy you are, and if you are a good candidate for dental implant procedure. Once this is decided that you are a good candidate for dental implants, an appointment will be scheduled for you to go through the first phase of dental implants, which is the surgical phase. The surgical phase may include directly dental implant placement, or it may include some type of site developments such as bone grafts and augmentation, or maybe a root of a broken tooth has to be extracted, and sometimes we have to wait, or sometimes we can place immediate implants. Every case is really individualized and is being tailored for an individual. So there is not one solution for a person. Once you get through the first phase and the dental implant is being placed, the second phase is the restorative phase, where you come and the dental and measurements will be taken to use this dental implant in order to provide you with the proper restoration, which can be a single tooth, multiple teeth, or all of the teeth in one jaw. The measurements include impressions, which could be either digital or analog type of impressions. It will include impressions of the opposing teeth. It will include shade selection to see what type of color is good for your teeth. And it will include multiple pictures of your smile pictures to see that we can actually match and make things better and improve the aesthetics. Once this phase is done, all this information is being transmitted to a dental lab where the implant restoration, a prosthesis will be made, which is again can be either a denture over implants like an overdenture, or a bridge, fixed bridge, all on X type, or a single tooth. Once it is made in the dental lab, it comes back to the office. You'll be scheduled for the insertion of the prosthesis that rests over the implant. We'll make sure during this appointment that everything fits well, that the bite is good, that it feels good to you as well, that it has a natural feeling, that the aesthetics are being matched, and that we overall improve the whole situation for you. What options are available for artificial teeth? So we'll speak about the fixed option first, and then we'll speak about the removable option. So the fixed option is going to be replacing single missing tooth with a dental implant. So that's the implant, missing tooth here, dental implant is being placed, and that's how it's going to look. This is a fixed option. Now, if you have multiple teeth missing, we can place the few implants and replace all of those teeth as a fixed option. Now, if you have all of the teeth missing, that will be replacing all of the teeth, and that's what I called in my previous videos as an all on X. All of the teeth being replaced by multiple implants, and it really is a fixed bridge over implants that stays in. You cannot remove it as a patient, it stays there. However, a dentist can remove it at will when it's needed. And there are like screws inside, it's being unscrewed and it comes out. All right, it comes back as needed by your dentist, and then you go home with this. So these are all fixed type of solutions. So we have a single tooth, multiple teeth, or all of the teeth. So three options for replacement by dental implants. On the removal part, it can be a removable type of a denture. For example, a lower teeth, lower denture, full denture, without implants will be just sitting on the gums and staying in place with the help of the cheeks and the tongue, and you will try to keep it in the position. However, with the implants you can improve the retention of this denture by just snapping it into place. It snaps and it doesn't come out, and it's a much more secure type of a denture. It's called an overdenture over two implants. It can be removed at will by you, and then you place it back. Great solution for people who are missing all of their lower teeth with two implants, 3 or 4 implants as needed. It also can be for the upper teeth. So this is a real patient. So upper teeth are missing, and this is a denture, and the denture is being rested on multiple implants. In this case, we have multiple implants and we have some bar over denture. So this is a different type of a removable denture, an over denture. In this case, it is a bar over denture, and it goes in. That's the bar. It's here, and this is the denture, and it goes over the implants, and it clicks in. It's extremely secured. The benefit of this over the regular upper denture is that the palate is open, and some people really want the palate to be open, so dental implants can provide a removable denture with an open palate. Just a few words about palate. The palate does have some taste buds, and people like to feel with those taste buds the food. They like to have their tongue over the palate. So this type of solution can provide you with a denture that is open on the palate. It's a removable denture, but the palate is open. However, it's a very secure upper denture. So these are the multiple types of implants that we have, removable and fixed. In terms of materials, what materials can be used to restore dental implants? For all the single tooth or bridge type of appliances, prostheses, the materials of choice can be porcelain fused to metal or full zirconia. Zirconia is a ceramic, a very strong ceramic, and it's being used to restore a lot of dental implants. It can be either a bridge or a single tooth. Just one word is that an implant by itself cannot have a tooth. It needs to have another connection, and the connection is called the abutment. The abutment is really the connection between the implant and the tooth, and you will need to have the abutment. All of the implants will have some type of abutments. This could be prefabricated abutments or custom abutments. It really depends on the case that we are doing. The materials could be also like in an overdenture. This will be acrylic denture, acrylic teeth. These are really, this is a subcategory of plastic. However, it's a very strong plastic. These are regular denture or denture teeth that are being used to snap on the implants. So in summary, the materials could be either acrylic materials with some type of metal underneath. It can be high strength ceramic material such as zirconia, or it can be a porcelain fused to metal, which is everything is done in metal and then it's being covered by porcelain to give it the whiteness of natural teeth. Um, uh, and it's really decided based on the situation, and every patient is different. It's being decided usually for the patient individually. In terms of colors, uh, there are different colors, different shades of white that can be achieved with implants. For example, in a denture, it can be slightly more yellow or more white, and there is a whole range of colors, and we just choose the right color for the patient. If you wanna, the consideration is if you wanna match your existing other teeth, or if there are no teeth at all, then we can choose any color. It can be white, it can be slightly off-white, but these are the colors. There is really a lot of colors to choose from. In addition, we can also get the gum color also. Whether it's a fixed bridge or removable, we can add the red color to the prosthesis. A bridge or a crown can have also the red as well. So in terms of colors, we have done some great progress in dentistry, and we have now a lot of colors that can match your existing teeth or give you a brand new smile with a really nice white color of teeth. How long does a dental procedure last? A dental implant procedure will last from a few months to a year or even longer. It really depends on how much work needs to be done. Just to keep in mind is that when dental implant is being placed, there is a waiting time of at least 2 to 3 months. Sometimes it can be longer, sometimes it can be 5 and 6 months, and it depends how fast the bone grows into the implant to keep it in place. However, some procedures can be done that dental implants can be restored on the day of the surgery. And most often, these are the situations where the natural teeth that are being lost or going to be lost will be extracted during the appointment, and dental implants are being placed at the same appointment, and a temporary type of prosthesis will be placed on this appointment as well. One appointment for all the procedures. People like it a lot because they just have to go through it only once. However, it's only for specific cases. The specific case is really all on X. In all on X, dental implants are being placed, and at the same time, same day or the next day, a, a prosthesis, a fixed bridge, is being placed as a temporary bridge first, and patient will go like this for 3 months, and after 3 months, maybe more, 4 months, it really depends on the how good the implants are. Then we can start the final prosthesis to work on the final bridge for the patient. The final bridge is it will take a few weeks to fabricate, from a few weeks to a few months, and then it really involves the measurement of dental implants, making sure that what you get, it will be in a good bite, and the teeth will be in a good position, and when you smile, you will show just enough for aesthetics. Those teeth, as we measure it, they can be moved either on a chair or digitally, and as the teeth are being placed in the right position and we get the ideal smile for you, then it can be finalized as the final prosthesis, final bridge, final crown, final overdenture. If we do extractions and bone grafts, and there is a waiting time of another 3 months for bone grafts, some bone grafts require waiting even 6 months. So if extractions are involved and dental implants come after the extractions, so there is a 6 months of waiting period, and after this the restoration can start. So it's not unusual to get an implant restoration after 3 months or after 6 months, and sometimes even after 9 months. The only exception, as I said, was the all-on-X type of situation, where on the day of implant placement, a patient can get a full prosthesis, the all-on-X full prosthesis. However, it is a temporary prosthesis, not the final one. And again, after 3 months, a patient will come and will be measured for the new final definitive prosthesis. Is the dental implant procedure painful? The procedure itself should not be painful because it is done under local anesthesia for the most part. If the patient is extremely anxious and wants to be sedated, then it can be done under sedation as well. Um, Most of the time, it's not being done under general anesthesia. However, if some cases do require general anesthesia, and then these type of procedures will be done under general anesthesia. Most cases of dental implants are just like tooth extractions. There is no need for sedation. They're being done under local anesthesia, and it is not painful because the anesthesia takes away all the pain. The only pain that will come will be from the needle prick, which is really the only part of the procedure that the patient should feel. Anything afterwards should not be felt at all. However, this is the procedure itself, and most people do exaggerate what happens on the surgical procedure. Uh, I do want to speak a little bit about what happens after the surgery. The recovery, when the local anesthesia wears off, um, the recovery could be more difficult if we speak about 2-3 days after. So to control this type of pain, which is the recovery pain or discomfort, you really as a patient have to follow up on your doctor's recommendation, and this may include pain medications, NSAIDs, or acetaminophen. These may include some type of narcotics such as Vicodin, and antibiotics and mouth rinses. So if you follow up on what your dentist gives you as a recommendation, the pain should be kept to the minimum. A lot of people report they have no pain at all afterwards because they follow the instructions. Some people report they had some discomfort, and then the dentist has to adjust the dosages of the pain medications. What anesthesia options are available when getting dental implants? So I mentioned slightly before about the different anesthesia types. First and foremost is the local anesthesia, and that just takes away the pain locally, where the jaw is, where the teeth are, where the gums are. This is the basic one, and these are given in all instances. The patient is awake. However, the patient does not feel any pain, because the anesthesia took away the pain. Now, if the patient is anxious and wants to be sedated, um, there are different types of sedation from mild to moderate. It could be a conscious sedation where the patient is not sleeping. However, the anxiety levels are very low or almost non-existent, and You can follow on the instructions, and you know exactly what's being done, but you are totally relaxed, or more relaxed than you would be without uh, the medications. These are usually just pills that will be prescribed to you. For a more advanced sedation, moderate or deep sedation, then this requires a little bit more clinical overseeing and making sure that the blood pressure is okay and the oxygen levels are okay. And these are usually being done in a more controlled environment. Um, Another type of anesthesia is the general anesthesia, where the patient is totally sleeping. These are usually being done in almost hospital type of clinics. So in general, these are like the three types of anesthesia that are available. We speak about local anesthesia, sedation, conscious sedation, and general anesthesia. Will dental implants last for the rest of your life? This is our hope as dental providers, that your implants will last for the rest of your life. Is this the case? It's not the case all the time. There is about anywhere between 0 to 5% reported failure rate of dental implants. It can be more, it can be less, but not all implants do survive long term. The good news are that over 95% of implants do survive longer than 10 years. And these are really the only studies that we have is 10 years. We have some 15, 20 years, but it's very difficult to follow up on patients for over 20 years. Dental implants do have high survival rate as long as the patient is healthy and has a healthy lifestyle and good oral hygiene. What are the costs and financing options available for dental implants? Like for any other dental procedure, the cost can vary from office to office. Some offices will offer financing options. You will have to find out with every office individually what is the cost, because it does range from office to office, and it ranges based on the skill of the doctor, um, the medical group that is supporting the doctor, what type of implants are being used, what brands, what type of materials are being used. All, everything considered, there is some range between the dental offices. For the most part, you really should choose the dental provider based on the dental provider and not based on the cost, if possible. Just looking at the reviews, looking at what other people say, and maybe speaking to previous patients of the same dental office will give you some idea where to get your dental implants. Do most insurance plans cover the cost of dental implants? Good news are that yes, some insurance plans will cover the cost of dental implants, whether in full or at least to some extent. Some insurance plans do not cover the cost of dental implants. It really depends on individual plan that every person has, and you have to check with the dental office to see what will be covered for you. How can you schedule an appointment to speak to a dentist about dental implants? So the best way is just call to your dental office, um, call call to your dentist and find out what can be done for you. You can speak to us. We'll be more than happy to provide you with answers. We are just a phone call away, and once you schedule the first initial visit about dental implants, this is when you will get most of your questions answered when you come to the office. I hope I was able to answer some of your questions about dental implants. If you have any more questions, I'm more than happy to answer them. You can reach us on our website, or you can call us directly at our phone number is 585 471 5689. Again, it is 585 471 5689. Call us, schedule an appointment. We are here to help. Thank you.